Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our today's COVID-19 briefing from British Columbia. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow there will be a written update at 3 o'clock that we'll be releasing. On Saturday, Dr. Henry will be providing a briefing here at noon. And on Monday at 1:30, there will be a regular briefing, which will include an update of some of the modeling from Dr. Henry. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So for today, April 30th, the last day of April, we have 25 new cases who tested positive in British Columbia, bringing our total to 2,112. That includes 815 people in the Vancouver Coastal Health Region, 961 people in the Fraser Health Region, 120 people on Vancouver Island Health Region, 170 people in the Interior Health Region, and 46 people in the Northern Health Region. We continue to have 24 active outbreaks in long-term care, assisted living, and 3 acute care units. We have no new long-term care facility outbreaks. We have a number of new cases, however, in long-term care, bringing our total to 256 residents and 153 staff who have been affected. And as we know, 12 of these outbreaks have been declared over. We have ongoing investigations in a number of community outbreaks, including 50 cases still at Superior Poultry and 42 at United Poultry, and that remains the same, although ongoing investigation and testing is happening. We have 120 cases now at the Mission Medium Security Correctional Facility, Federal Correctional Facility, so that's an additional 12 inmates who have been tested positive at that facility. And again, the investigation and the monitoring of everybody in that facility is ongoing. We know that there are many people who have already been exposed, and so we expect there may be more people who develop symptoms over the coming days and weeks. Of our cases today, 82 people are in hospital, and of those, 30 are now in critical care or ICU. We've had an additional 2 deaths related to COVID-19 here in BC, including one senior in our long-term care home and one person who died in hospital in Vancouver Coastal Health Region. We now have 1,322 people who have fully recovered from COVID-19. Today is another one of those landmark days in that it's been 100 days since we put out our first warning and statement around what we were calling then the novel coronavirus, our first provincial statement. We did it because we were concerned about what this detection in China at the time might mean for all of us, and how this virus that we needed to pay attention to, that we needed to start thinking about preparing for the possibility that was coming here to British Columbia. We want you to know that the risks of what now we know is COVID-19, what they could be, and what they could be in China and with travel initially, and then as it spread around the world. We wanted to know that we remain committed to making sure that we do continue to provide the information that everybody in BC needs to continue to stay safe. In the last 100 days, we have all watched as the pandemic spread, first in China and then around the world, and affected us here in British Columbia and across Canada. Our lives, our businesses, our communities have dramatically changed in this last 100 days. And yet one thing really has stayed the same, and that is the unwavering commitment of everybody here in British Columbia to work together and to keep our firewall strong, to do everything we can to protect our communities, our seniors and elders in particular, and our families across British Columbia. In the coming days, we're going to be sharing updates about our modeling. I'm going to be sharing more of the epidemiologic information about who's been affected and where. And this this modeling in particular continues to inform our thinking based on what we are seeing here in British Columbia, our pandemic, and it's what will help us move into this next phase. And the Premier will be speaking next week, as we've indicated, on our go-forward plan. And our goal is to continue to give you all of the information you need to keep safe as we move ahead. Right now, we need to stay strong and continue to bend our curve down. We all need to be champions of safe physical distancing, of hand washing, of staying connected at a distance to those who are at high risk and who may be alone, and those in our community. We need to support those around us to self-isolate when they are ill, to make sure that all of us take responsibility for ourselves and for our children to stay away from others if we are sick. We need to continue to be caring and compassionate to our friends, our neighbors, our community, and to show the appreciation for the countless British Columbians who are protecting us, whether they're healthcare workers, whether they're grocery workers, whether they're ensuring that we have food on our table. And we need to continue to do all of this by being kind and being calm and staying safe.
Thank you very much, Dr. Henry. I want to start by acknowledging the two people who have passed away in the last 24 hours, one in the Fraser Health Authority, one in the Vancouver Coastal Health Authority from COVID-19. We know what this means for the families. We know what it means for the caregivers. We know what it means for those communities. And these are significant events, difficult events in this time to mourn, but because it's difficult for us to come together, but we want everybody to know that everyone in BC, everybody in the government, from Dr. Henry to everyone on the health side, to the Premier, everyone is thinking of them today and mourning the loss of their loved ones, and send our condolences to the families. As Dr. Henry has said, we have a significant, we have 25 new cases of COVID-19 in BC. A significant portion of those increased number of cases at the Mission Federal Correctional Center in Mission, BC, and so those are significant events that continue to show an overall increase in the number of cases in the province. What's happened there and what's happened in the poultry industry in Vancouver and in Coquitlam is a warning to us of why we need to continue to be vigilant. There is a continuing trend that's positive in both critical care and in hospitals in BC. We have 82 people in hospital from COVID-19 in BC, 41 in Fraser Health, 4 in Interior Health, 5 on Vancouver Island, 3 in the Northern Health Authority, and 29 in Vancouver Coastal Health. That's 82. As you'll remember, the high in terms of hospitalization was 149 on April the 6th. Equally, we've seen a reduction in the number of people in critical care, 30 today. This is down from 44 a week ago and a high of 72 also at the beginning of April. There are 4,100 available hospital beds in BC. Our current level of utilization of the system is 63.2%. And of critical care units that have been set up in response to COVID-19 or are established already, we have 44.6% level of occupancy. I'll note again, and we've made this point consistently, that the healthcare system is available for people at this time, people who are struggling with other conditions than COVID-19. 4,481 visits yesterday to emergency rooms in BC, a number that continues to be higher than it was a couple of weeks ago when we hit a low of 2,995. But it should be said that on March 9th, just to put it in context, there were 6,559 cases, emergency room visits in the province. We're still below that, but people are returning, and we appreciate that. I want to speak about some of the some options that are available for people who are dealing with paying for prescription drugs at the moment. We'll talk about the Fair Pharmacare program. This information is available online through both through our app and our online websites, and more information is available from HIBC, Health Insurance BC, You can call toll-free at 1-800-663-7100. What it says and what this note says is that Fair Pharmacare, which almost all British Columbians are enrolled in, that Fair Pharmacare covers dispensing fees if you've met your deductible. In other words, if you've and we're early in the year, but if you've met your deductible, Fair Pharmacare pays $7 of your pharmacist dispensing fee, $10, and if you met your family maximum, it pays for all $10. So that's happening now, and Fair Pharmacare does cover dispensing fees. If you're registered for Fair Pharmacare, but you've had a loss of income, you've lost your job, you can request an income review to get your deductible adjusted, which is based on income. If you have lost income due to COVID-19 and are eligible for provincial or federal assistance programs, you can contact Health Insurance BC at the number I mentioned before. And finally, if you're struggling to pay your deductible, the monthly deductible payment option lets you pay your deductible in small payments each month through the year. This way, Fair Pharmacare covers 70% of your eligible costs right away. This is an option for people who know they will meet their deductible every year, which is the majority of seniors enrolled in the program, for example. This gives them some assistance, especially with cash flow at this difficult time. So I again repeat the number. It's toll free, 1-800-663-7100. I want to briefly update you on the single site proposal. This is a proposal in long-term care that will have people working in long-term care restricted to working at a single site. This is the result of successive medical health officer orders where it was applied immediately to all sites where there was an outbreak, and then to a provincial health order in the beginning of April at around April 9th. And I just wanted to let you know the progress and what we're doing with respect to that. On Monday, in fact, I said I'd provide this update, and I'm pleased to do so today. I want to acknowledge first the HEU, the BCNU, the BCGU, BC Care Providers, HEABC, and many more who supported this change, and the team at the Ministry of Health, which is assisting health authorities in implementing that change, including Steve Brown and the team at the Ministry of Health, and especially all the health authorities for working to implement this complex and necessary change, and for providing the results that enabled this report today. There are, just to put it in context, 45,000 unique employees in BC long-term care facilities, assisted living facilities, private hospitals, standalone extended care hospitals, and provincial mental health facilities. Of those 45,000 employees, there are, or at least were, 7,350 employees who have jobs at multiple facilities. And the multiple facilities involved, there are in fact 545 facilities that host multiple facility employees. And here is where we are right now in dealing with this complex situation. Of those 545 facilities, 276 have completed their single site plan, so that's just over half of the employees. And that's 43 in Interior Health, 40 in Fraser Health, 103 in Vancouver Coastal Health, 64 in Island Health, and 26 in the Northern Health Authority. And we expect more progress, significant progress next week. These are the ones that are completed. We're not releasing partially completed. All 545 are underway, but this will be one of the issues and the facts that we'll continue to update every Thursday at these briefings, so people are aware of the situation that we're in. And finally, I just want to speak briefly again to all those who are waiting for surgery in BC. The Premier said yesterday and talked yesterday about the changes that are coming to address the new normal in British Columbia. Not, of course, going back to where we were in December, but going forward to a situation where we will be able to do more in society, to be less restricted in society than we are now. That doesn't mean there won't be rules or demands or challenges. Many of the people who have sacrificed the most are the now people in the tens of thousands who have seen surgeries, scheduled surgeries, delayed. And this is a group that we think about every day. And as we plan for this unprecedented surgery renewal, and as we proceed through its delivery, we're taking care to do it right and to ensure we learn and adapt every step of the way. We're giving the same effort to surgery renewal that we have made in the last weeks and months since January in addressing COVID-19. We bent the curve on COVID-19, and we're going to bend the curve for those who desperately need surgery as well. It's going to challenge every single one of us in healthcare, and it will take resources. We know this. But the thousands of people who need their surgeries are counting on us to deliver. It won't be easy, and in the weeks and months to come, it will push us just like COVID-19 has. But as Dr. Henry always reminds us about how we face head-on challenges, such as that COVID-19 puts in front of us, it's not forever, it's for now. Everyone involved is all in on surgery renewal, and we will be presenting updates and a plan to British Columbians in the near future. But what they need now, right now, from all of us, and what they need from us here, but from all of us, is that we stay 100% all in to stop the transmission, 100% keeping our COVID-19 numbers manageable so we can keep surgery renewal proceeding with full force. That's what we need to do for those that we love. That's what we need to do for those that we don't know. That's what we need to do for everybody waiting for scheduled surgery in BC. Je veux dire quelques mots en français. Aujourd'hui, nous annonçons 25 nouveaux cas pour un total de 2112 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer 2 nouveaux décès liés au COVID-19, un à Vancouver Coastal, un à Fraser, pour un total de 111 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Chaque région de santé de la Colombie-Britannique compte des patients atteints de COVID-19. 815 se trouvent à Vancouver Coastal, 961 à Fraser, 120 sur l'île de Vancouver, 170 dans l'intérieur et 46 au nord. Parmi l'ensemble des cas confirmés de COVID-19, 82 personnes sont actuellement hospitalisées, dont 30 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Thank you very much. Happy to take your questions.
Thank you. As a reminder to everybody on the phone, please press star 1 to enter the queue. You will be limited to 1 question. I would also ask that you please unmute your phones. You will not be audible until I call your name. First question is from Vaughn Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. In your count of long-term care facility outbreaks today, you said there are 24, I believe, that are active and 12 where the outbreaks are over. With all the contact tracing you're doing, how many of those 36 outbreaks have been traced to staff moving between more than one facility, please?
Yeah, very good question. It's sometimes very difficult to know because the first person who might be identified may not be the person who's moving. But we do know that a good proportion of them, so I don't have that exact number. I do know that the majority of them have been related to staff, and often, many of them, as you will know from the list that we give, it's a single staff person who's been identified that we've declared the outbreak regarding. So sorry, I can't really answer that question for you, except that it has been an important consideration, and at least a number of them, particularly early on, which is what triggered us to enact this a single site protocol. I will also say that, you know, this is not something new to this outbreak or this pandemic. This is something that we have recognized as a challenge every year. Every year, as people are aware, we have outbreaks of respiratory illness in our long-term care sector, primarily influenza, but we also have outbreaks of RSV and other coronaviruses that circulate, that cause illness in long-term care homes and cause a fair amount of both people getting sick, but also people dying from it. So it has been something that we have recognized for many years as a challenge, not only for respiratory outbreaks. We also have gastrointestinal outbreaks that go between facilities where that can be taken by people. And very recently, in the last number of years, we've had challenges with carbapenemase producing organisms, so these multi-drug resistant organisms that can also be transferred between facilities and can cause outbreaks. So this is a measure that I believe is important not only for this pandemic, but as we consider how do we best protect our seniors and elders in our long-term care sector going forward.
Next question is from Justine Hunter, Global Mail.
Hi, thank you. Federally inspected processing plants are supposed to have a COVID plan in place. Coastal Health is telling us that they found those plans to be lacking at those 2 poultry plants where we've had the outbreak. Who should have been responsible for making sure those plans were in place?
Yeah, so it's obviously a challenging question. There's a shared responsibility around, so there's food safety plans and then there's healthcare worker safety plans. So we would expect that they go hand in hand, but sometimes people who are responsible for this food safety part may not recognize some of the key things that happen on the healthcare workers, or the worker safety side of things. So we do have WorkSafe BC, which has a role, for example. Public health inspectors also have a role around if there are transmission of illness, either between staff or because of the product that's been produced in that plant. And, you know, we have a role, for example, where we've had outbreaks related to contaminated products from plants in the past. So it is a shared responsibility, and I think in this case we clearly needed to do more work on making sure that these plans for worker safety were more robust and were enacted in a more robust way. And that is what we are doing now as part of our going forward in our new normal. When we start looking at other workplaces, this is something that is very important and that we have been talking about to government and to the stakeholder groups. We are going to have in BC provincial level guidance, best practice standards that we will have in each of the different sectors, so that we can all be confident that we have the right plans in place to protect those of us who are going into those settings, the workers in those settings, and making sure that we are all really aware of the things that we need to do to protect us all in this next phase that we're going through, why we still have COVID-19 circulating around the world.
Next question is from Tanya Fletcher, CBC.
Hi, Dr. Henry. In Alberta, your counterpart has said that people can go outside with a small number of friends as long as they aren't sick, as long as they stay 2 meters apart and they don't share food or drinks. Can you clarify or perhaps give more definitive language around that? You have talked about expanding our personal or social circles, but can you clarify what that means with spending time with friends outside? And if so, what has to change for that to be allowed to happen?
Yeah, so here in BC, of course, we have always maintained, and it's something that I feel quite passionately about, as you probably are aware, that being outside is important for us to be able to release when we're going through such stressful times as these, and that we need to do that, though, safely. And that means maintaining our distance and going with our family, our household group, our circle. As we're moving into the next phase of this, we need to consider each of us and our own family, how we want to and how we can expand our circles, but doing it in a way that is safe. So that does mean, yes, we might be able to connect with others in a way that we haven't been able to do in the last little while. But we need to be thoughtful about it, because the more groups and people that we have connections with, the more chances are that we might transmit this virus. And so we need to be careful about our own situation. And it may be fine for young people who are by themselves, for example, to connect then with other small groups of friends. We're not going to have large groups gathering together. We're not going to be having indoor parties in this coming summer. But we can look at how we can safely have more contact and more people in our lives to have those circles slightly bigger. The challenge is going to be, how do we protect those people that need it most? So if there's somebody in my family that's going through cancer treatment, for example, I'm not going to expand my circle very much because I need to protect them. So if I'm going back to work, then I need to be careful about things like going outside and meeting with others. Even outside, we know that the safe distance is protects us. But we need to make sure that we are maintaining that, and so that we don't bring somebody home, something home that might affect somebody who's more vulnerable. And I've said this before, it's going to be a challenge for us. We need to be very thoughtful about it. If we are going back to work in our workplace, we're going to increase our connections in our workplace. And it may be that we have our children are going to stay with the grandparents. So we need to be cautious then, because we've now increased our circle that might affect people who are elder in our community. So we need to be careful, and they may not then go and spend time with other friends, because then you have those connections again that might lead to bringing that home to your family and people who might be most severely affected. So I know it sounds complicated, and I'm thinking about ways of trying to articulate that in a way that is a bit more understandable. But really it is about thinking about how we, as social beings, expand our circles slightly, but not to where we were before, and make sure that we continue with the basics. And we are very aware of the vulnerabilities of people who are in our circle. So it includes continuing to wash our hands regularly, continuing to maintain our safe distance, and particularly when we're at work, when we're in going shopping in the grocery store, making sure that absolutely we stay away from others. If we're sick ourselves, or if our children are sick, that we stay home, that we don't go out, even outside, and connect with others. And we'll be talking more about this, and I'll try and find some way of making it a little bit more understandable. But I think the idea is really we want to increase our social connections in a safe way for the coming time.
Keith Baldry, Global News.
Hi, thanks for this, for both of you. Question about casinos, which are a major source of revenue for municipalities and nonprofits. They're one of the few businesses that have actually been closed by a public health order. Given the new normal of social distancing and such, can you envision any circumstances under which a casino would be able to reopen?
You know, that is one of the ones that has been closed under a public health order, and it would be last on my list to consider for reopening at this point, because we know that that type of environment, one is an enclosed environment, an inside environment. We know that many of the people who frequent that environment are older people, or people with underlying illnesses perhaps, people who might be more or are more vulnerable to having severe illness from COVID-19. So, you know, I would have to be convinced that there's a valid reason and a safe way to do it. And I think that's something that is for further down the line. It's certainly not in the first phase of what I'm considering or what we're considering in terms of how do we get things moving again in our economy and in our social structures.
Binder Sudgeon, CTV.
Hi, Dr. Henry. We've talked about asymptomatic transmission before, and currently I know in BC we only test people who have symptoms. At the same time, we're getting warnings from RCMP that people are trying to sell black market COVID tests online. So I guess my question is, what's your message for those who want a test, who may not be symptomatic, and especially when there is a lot of capacity for more testing at this time?
Yeah, so in general in the population, yes, if anybody has any symptoms, and we're being quite free with that. So it doesn't have to be cough and fever. It can be any of the myriad symptoms that can be, we now know, related to COVID-19. So yes, we have a low threshold for testing people, but we also know this test is not valid, and none of the ones that are out there, whether they're in the black market or whether they're ones we're experimenting with, are perfect. And in particular, we know that they're not very accurate, or not as accurate as we want them to be early on in symptoms, or when people have no symptoms at all. So we know now that we have a low prevalence. So that means not many people, maybe 1 or 2% of people in our community have this virus at most. And so when you have a low prevalence, your chances of having a false negative and a false positive go up dramatically. So the test doesn't help you in that case. And in particular with this test, we know that if you have no symptoms and it's negative, it really doesn't tell you anything at all. It's not a valid test. It doesn't help you. It doesn't mean that you're safe, because you could have been exposed to the virus potentially, and you're still in the incubation period. the test is negative today, but you may start developing symptoms tomorrow. So it's really important, and I know it's another one of those complicated issues, but sampling people with the tests that we have, the diagnostic tests that we have, who have no symptoms in general, is not helpful to anybody. We do asymptomatic testing in situations like outbreaks, where we know that there's been close contact and exposures, and there's a higher probability that somebody might be early on in their symptoms or pre-symptomatic or may not be noticing it. And so, for example, we've tested everybody in the prison setting. As you can see, there was all of the inmates, there was a number of them that tested positive right away. And then we continued to see people developing symptoms, even though they might have tested negative a few days ago. They've now developed symptoms and tested positive. So we need to put it in the context of somebody's risk, and in epidemiology we call that your pre-test probability. So if you've not been around anybody and you don't have any symptoms, your pre-test probability is very, very low, and the test is not very accurate in that circumstance.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. I have been hearing from childcare providers who were told on a teleconference last night there's little risk to kids or staff in daycares, and it's now okay for operators here to start running again at full capacity. Considering the recent outbreak in Toronto, is that true?
Yeah, we do believe, and we've looked at this around the world, that there's still very low risk to children. We are still learning about whether children actually, have a lower risk of being infected overall, or do they just have more asymptomatic infection, and what is the risk of a child who doesn't have any symptoms passing it on to adults. And there's still, I absolutely agree, it's a very low risk setting as far as we can tell from all the data we have so far. Having said that, we have never completely closed childcare facilities, because we know it's an important part of the essential service to support people who need to go to work. And the early childhood educators, the people who work in our childcare centers are a critical part of helping sustain the essential services. I will say that it is something that we need to do safely, and going back to full capacity is not exactly where we are right now. So it will be going back to how can we care for children safely, both for the kids and for the educators and the childcare workers, to make sure that that we maintain the important things that we know are protective for this virus.
Next question is from Rob Monroe, Info News.
Hi, Dr. Henry. I want to talk to you about the temporary foreign workers. You mentioned yesterday that 900 have come in and been isolated and are starting to go out in the community, and 4 were tested positive. A lot of those workers, in the end there will be thousands of them coming to the Okanagan. We had an outbreak here, and it had a second outbreak with it, and some of these people are separated from or isolated for up to 6 weeks. And so 2 sides of that. One is, how are these people being treated in Vancouver in isolation? Is this total isolation, or is it in a group setting like it was here, so there could be further contamination? And the people may be reluctant to come to work in Canada if they fear having to be, in a sense, locked up for 6 weeks. And on the other hand, are they all tested before they leave to make sure that when they come to places like the Okanagan, that we can be confident that they're not bringing COVID with them?
Yeah, so a couple of things. It was the outbreak that we experienced in the Okanagan that really made us recognize that people in communal settings, like they were, even though they were very good accommodations, it was very challenging for the workers in those settings to isolate from each other. So once the outbreak gets started, and we have not had new cases, so I'm keeping my fingers crossed, not had new cases for some time in that group, it was very challenging to isolate. So people had been exposed over a long period of time, and that's what led to the fact that it's taken now, we are closing on 6 weeks, because early on people were still having contact and transmitting to each other. And as we know, once you've had exposure, there's nothing we can do to prevent you from becoming ill. What we need to do is isolate you so that you're not passing it on to others. And we are nearing the end of that outbreak, and I will say knock on wood, because it's been managed very well. So that is what triggered us to put in place the measures that we have put in place for the additional temporary foreign workers, just over 900 as of last count. It's probably a little more now. And what we have done is put them up separately, so they are not having contact with each other. They are being provided in a hotel accommodation, so they all have their own bathroom, their own room. They're provided food. They're provided with means to have contact. They have outside time, but we maintain the physical distancing. We maintain the hygiene that's necessary. And so those people who developed illness were removed to a separate area as well in the hotel, so that there was no possibility of cross-contamination. So we are very confident that those who have completed their 14 days have not had contact with anybody who is COVID positive, and there has been a number of tests being done. So there's been a number of workers already who are now moved on to the farms that they're working on. And this is a process that supports everybody. We make sure that they get the health care they need in this time. And I really want to commend the job that was done by Vancouver Coastal, the Mexican consulate, which has been very supportive of particularly the Mexican temporary foreign workers. And this is the process that keeps us all safe. It keeps them safe. It keeps our communities safe. And so we expect that process to continue.
Next question is from Brishti Basu, Victoria Buzz.
Hi, Dr. Henry, ministers, whoever can answer this. I was wondering, what type of legislation in the long term are you hoping to see that would prevent employees from going to work sick due to fear of missing wages? And is there a public health order that you can enact in the short term to make this a law?
Yeah, the short answer is no. It's very challenging to, labor relations is not something that I can order. However, this is something that is incredibly important during this period of time, and I know government is looking at ways to support that, and I don't know if you want to talk to that.
I think the Premier spoke to this at some length in yesterday's press conference as one of those issues that we're looking at as we prepare for the next phase of our efforts against COVID-19 in British Columbia. So it's a very significant issue, and as I've mentioned, I know Dr. Henry has mentioned, in the hierarchy of things we need to do, staying home when we're sick is very important in that, as important as some of the others, washing hands and so on. So this is a high priority for us. It's something that the Premier said very directly yesterday that he and Labour Minister Harry Bains are working on, and it's a high priority for all of us. I think in the new normal, we have to do some things differently from the way they were done before. And not going to work, not going to school, not visiting our loved ones when we're sick is high on that list. And we have to, I think, very vigorously look at that, and that's what's happening. This is a very methodical process that we're going through. It has been since January. It continues to be, to deal with issues as they arise, to not be afraid to change and adapt. And that's what we're going to continue to do in British Columbia, and to always, always be guided by the science.
Next question is from Amy Smart, Canadian Press.
Hi, Dr. Henry. The FDA says it's moving quickly to approve the drug remdesivir for treatment of COVID-19. Are BC or Canadian officials studying its effectiveness? And if so, how promising does it look to you, and how early do you think it could be available?
Yeah, so remdesivir is one that we've been looking at. We early reports out of China actually some weeks ago suggested that it might be helpful. As we've talked about months ago, it seems like now, when a new virus arises, we look at all of the antiviral medications that are out there to see if any of them might have some effect. There's been other medications, as you know, that have been trialed as well. But remdesivir is one that has, it's produced by Gilead, that has had some positive case reports out of China. And then more recently, I know Dr. Fauci in the States was talking about it yesterday, that there was a randomized controlled trial. So they had a placebo and remdesivir. He reported that the results were very positive, and we know that the trial was stopped early because one group was doing better than the other group, and when it was unblinded, it turned out that it was the group that was receiving the medication that was doing better than the placebo group. So that is promising. But we have not yet seen the data from that trial. So this is all normally what we do is, as scientists look at it and they study the data, they get a better understanding of, what group is it, were they comparable, who's the people that are going to benefit most from it. So this is an antiviral medication. It doesn't stop you from getting infected, but what it does do is it turns off the mechanism that allows the virus to leave your cells. So viruses inject their DNA, their nuclear material, in this case RNA, into your cell. It takes over your cell's reproduction mechanisms and it makes a whole bunch of copies of itself, and then it has to get out of the cell and into your bloodstream to infect other cells. And so this is a drug that helps prevent that from happening. And it appears that people who have severe illness, so they're hospitalized or in ICU, it might be an effective drug to help them recover quicker. So in that context, it looks promising, and that's very good news. And I think it's something we should all be excited about. We are in BC and in Canada participating in a number of trials that include remdesivir. We need to continue the randomized controlled trials to have a better understanding of exactly how it works, how much, and who it's going to work best for. And we will be continue to participate in those. And we'll be looking at how we can increase that participation. So I think it's a very positive thing, but with cautious optimism because we don't yet know all the details.
We have time for a couple more questions. We have Shrishti Gangdev, CKNW.
Hi there. I just have another question about the outbreak at Mission Institution. That increase of 12 cases today is almost half of our total case count increase for today. And the institution has been on lockdown for almost a month now. And I'm just wondering why, in that circumstance, you think that with limited interaction, I guess, between inmates, the number of cases is still likely to increase.
Yeah, because we know that the incubation period for this virus is quite long. So there are people who were exposed up to 2 weeks ago who are starting to become ill. And in the institution itself, it's very challenging to have complete isolation of people. And it can also be very punitive in that type of a situation. So we do know that there have been exposures, unintentional, obviously, and there are a lot of infection prevention and control measures that have been put in place, but they have been within the last 2 weeks. So we are still in that incubation period where we would see more people becoming ill. I'm hopeful, and we've been seeing that it's dropping off quite dramatically. But as you point out, we are controlling these outbreaks in other places, and that's really positive for us. And it speaks to how important it is for us to be able to detect any outbreak early, because the earlier we get it, the quicker we are able to control it, and we need to prevent them as much as we possibly can.
Before we go to our last question, just a reminder for any reporters that didn't get to ask a question today, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Dominique Levesque, CBC Radio Canada.
Hi, I'd like to ask the question in English first and have an answer in French after. I was wondering if there were any guidelines for sharing businesses like car sharing or Airbnb, and also circular economy concepts like distributing food or buying and selling secondhand items or just sharing items.
Question. The basic guidance that we have around hygiene and spacing and distancing, but we have not yet, that I'm aware, have specific guidance for those things. But when we approach each of the sectors, those are the types of things that we'll be looking for. We'll provide the basics, and we'll be looking for them to provide us with their plans of how it can be done safely, and then we'll work together on making sure that we have that in a standard that can be used by everybody in that industry.
En français, je vais essayer de suivre cela, qu'il y a pas maintenant une direction générale envers ces industries-là. Or, les directions générales s'appliquent, bien entendu, mais il faut travailler dans chaque secteur, et il me semble, pour répondre à la nécessité de protéger, de sauvegarder tout le monde. Donc, il va falloir développer avec ces industries, sous la direction générale de Dr. Henry et des autres, dans la région de santé, un peu partout dans la province. Il va falloir mettre en place des règlements, des guides pour, en quelque sorte, guider ces secteurs de protéger tout le monde. Et ça va être plus difficile pour un secteur qu'un autre, mais c'est ça qu'il faut faire pendant cette période du nouveau normal, si vous voulez, que tout le monde travaille sur ces questions. Et ça va être différent pour les casinos que pour des autres types d'organisations, comme vient de dire le Dr. Henry. Mais quoi qu'il en soit, il faut que tout le monde se mette au travail pour assurer la protection de tout le monde. Thank you very much. Merci beaucoup.
Thank you.